Dear fellow shareholders, on behalf of the VRP Medical Center Board of Directors, I present to you the year 2020 in review. The new year 2020 opened literally with a big bang when Taal volcano erupted in January, leaving a devastating trail of destruction and threatened nearly 1 million people across Calabar Zone, Metro Manila, and some parts of Luzon. We were not directly affected by the Taal eruption. Still, we readily launched Tulong-Tulong para sa Taal Medical Mission, organized by the VRP Medical Staff Organization with a 40-strong team of doctors, nurses, and clinical and non-clinical staff. We provided free medical consults, medicines, vitamins, and relief goods to almost 300 families with 1,000 evacuees in Talisay, Batangas. The medical mission formed part of VRPMC's collaboration with Mount Grace Hospitals and the local government unit in reaching out to the victims of this calamity. This project for a cause culminated VRPMC's 47th founding anniversary celebration in February of 2020 with a week-long traditional pocket of activities. The Sports Fest, Employees Awarding, Residents Graduation and Research Presentation, and Bloodletting. Shortly after the Taal volcano eruption, an outbreak was foretelling when the Department of Health confirmed the first case in the Philippines of the deadly novel coronavirus that originated from Wuhan, China. Our first response to the impending pandemic was to closely monitor the situation and create a team to mobilize infection prevention and control measures in the hospital. While DOH announced increasing new confirmed cases every day in the country, we admitted our index patient on March 10, 2020. COVID-19 cases surged in the following days, prompting the government to raise the alert level to the maximum code red sub-level 2 and place the National Capital Region on enhanced community quarantine, marking the first massive lockdown in the country in recent history. We did not wait any second longer with this breaking news and jump-started our COVID team of doctors to assemble for this outbreak. We started to meet regularly with our Infection Prevention and Control Committee Chairman and Clinical Department Chairs and Committees. They immediately developed their respective department protocols for the safety of our patients and healthcare workers. The IPCC also started implementing hospital-wide best practices on infection control from the DOH and WHO recommendations to protect our patients, frontliners, and healthcare workers from the virus infection. We have responded swiftly to the COVID-19 crisis by establishing recovery plans, but the impact of the pandemic still hurt our business imperatives for 2020. As reflected in our financial report, this global crisis brought a decline in our gross revenue by 18%. Gross profit is also 28% lower and 34% below target. Our gross profit ratio is 32% versus 37% target. The unlikely situation called for immediate reconfiguring of operations for us to cope with. One of the earliest mitigations we put in place was skeleton staffing, which helped decrease our expenses by 26% from 2019 and 21% lower than the budget. Responding to the pandemic was a big undertaking with extraordinary challenges. This crisis led us to innovate and be creative to mitigate the unpredictable odds with our recovery plan. COVID-19 crisis disrupted the execution of our business plans in favor of the most compelling needs and demands of the time. The most critical and pivotal in this kind of crisis management was to activate our COVID core team made up of medical administrative officers and staff. The core team inked the 6-point recovery plan, which we immediately implemented. Patient and healthcare worker safety, leverage information technology, constant internal and external communications, increased revenue, cost management, and cash flow management. On patient and healthcare worker safety, we strengthened our safety protocols for our patient and healthcare workers through the following: Manual of protocols for screening, proper use of PPEs, disinfection, occupational health and safety standards, contactless patient screening, social distancing markers, controlled foot traffic, roving safety marshals, free RT-PCR testing and subsidized baseline testing of employees, temporary housing for employees, installation of negative pressure, exhaust air cleaners, HEPA filters and other ventilation systems, rotational duty for employees, residents and consultants to reduce the risk of transmission, hospital zoning for COVID and non-COVID areas. Most notably was the construction of ER2 and the ambulatory consultation and swabbing unit, which was a huge accomplishment for us. Our team completed this brand new facility in just 50 days, specially designed to manage COVID cases. On leveraging information technology, the pandemic has made us more technology literate, and we discovered that we could actually accomplish work efficiently virtually. We started developing digital solutions to meet our patients where they are and serve their emerging needs. One of the earliest projects we launched was our eConsulta, our telemedicine program. We also developed technology-based services like telerehab and digitization of transactions using QR codes for health declaration, e-appointments, and e-payments. We also explored other web-based and app-enabled programs for patients' total digital health solutions. On constant internal and external communications, virtual channels and social media have become vital for effective internal and external communications. VRP probably became the most visible hospital in the MGHI network for flooding the social media with updates and features at the height of the pandemic, especially when we launched our send-off videos of our COVID-recovered patients. Face-to-face meetings were restricted, but we frequently communicated by holding virtual town hall meetings, daily COVID-19 dashboard via Viber groups, and focus group chat rooms. We also created a central Google Drive where doctors could easily access protocols and memos online. On increased revenues, before the onslaught of the pandemic, we've already implemented a price increase in January that gave some room to fill up the forthcoming unforeseen vacuum. We also strengthened our corporate accounts for volume requirements for testing, services, and guaranteed hospital admission. And during the pandemic, we developed and offered new tele-solutions as an alternative to face-to-face services. On cost management, to manage cost, we implemented skeleton staffing and forced leaves amongst our staff. We reduced fixed costs and professional fees. We closely monitored the purchase of supplies, pharmacy, and other inventory, and we reprocessed PPEs and accepted donations for supplies, food, and other essentials. On cash flow management, to manage the cash flow, we deferred the construction of the VRP tower, which was supposed to start in 2020. We also rescheduled the acquisition of some machines and postponed the purchase of major hospital equipment scheduled for 2020. Lastly, we closely monitored collections and maximized payment schedules and releases. Despite all the challenges encountered, I am pleased to report how we have responded and have risen and reinvented ourselves in the new normal with innovations and milestones designed to meet the needs of our patients, employees, doctors, and other stakeholders. A summary of our innovations and milestones will show the big picture of VRPMC in the new normal that cares. Some of our patient-centric innovations include eConsulta, Patient Digital Portal, Tele-Rounds Home Care, Tele-Rehab, Curbside for laboratory tests, Meal Trays Get Well Soon cards, Wall of Hope, Scent of Celebration for recovered patients, and other sustaining customer care services. We ensured workplace safety and health practices for our employees and doctors with safety webinars and daily safety reminders in various channels. We also provided mental health awareness and wellness webinars and essential counseling services for our employees. Amidst the lockdown, our board of directors continued to meet virtually. We passed resolutions to approve the appointments and renewals of contracts and accreditations of medical and non-medical personnel and support groups. We purchased necessary equipment with all due diligence to the cost and cash flow management. The succeeding slides and pages of the 2020 annual report will present the performance highlights and milestones of the hospital administration and medical departments. One of the highlights in 2020 was the painstaking effort of our Human Resources Department in applying for the Department of Labor and Employment's camp assistance to 494 employees and the DOH SRA for identified COVID case employees. The total cash that we received for our employees was 2.395 million and 2.551 million from DOLE and DOH. The best reward we received in 2020 was seeing our hospital dashboard for COVID-19 patients with a significant increase of patients who recovered, with 84% recovery rate. With this, we have become one of the best hospitals for COVID patients, according to our HMO partners and some other external customers who recognize our track record. We are happy to send off more recovered patients after providing them with the best medical attention and care. The economic forecast for 2021 is still unresolved. Some experts said that the pandemic would continue to slow growth and shrink the global per capita income. We do not know what the next year will bring and how the COVID-19 vaccine program will help. As we embark on 2021, we recognize this time as an opportunity to build back better. We commit to developing long-term sustainable strategies and innovations that will serve our customers' medical and health needs, whether COVID and non-COVID related. The rapid response and resourcefulness displayed by our employees and doctors at the time of the pandemic were nothing short of exceptional. We will continue to carry on in the new normal, delivering babies, caring for the immunocompromised or geriatric patients, attending emergency cases, performing surgeries, or responding to an outbreak. We envision VRPMC to be known as a safe hospital with its signature Alagang VRP customer care in the succeeding years. In closing, the year 2020 was one for the history book, a year like no other that has caused unprecedented global health crisis and human toll, economic recession, travel restrictions, school closures, and social and mental health crisis. It was a year best described by our administrator in a profound one-sentence executive brief. The year 2020 is a year we came face to face with an unseen and unknown virus with no institution, no specialist, nobody was prepared for. However unfavorable it was, this year made us more creative, innovative, and resilient. We learned to cope, adopt, flex, and take actions to meet our internal and external customers' emerging needs in the light of the pandemic. Whether the weather is good or bad, we will keep going with a stronger team to define and deliver our business imperatives in the succeeding years. Thank you for your continued confidence and support in implementing the plans of action for 2021. God bless the work of our hands. Mabuhay tayong lahat.